Hello, it's Dr. Geoffrey of Split Second Decisions. And today we're going to talk about the TLC factor. And again, as we've said, I don't mean tender, loving care. We're going to talk about the L part of the TLC factor, the lack of information. Again, the lack of information. Let me start by saying this. St. Francis Bacon, an English philosopher, is being known for saying that information is power. And that is so true. But a lack of information does not mean you are powerless. We've already discussed the time part in the previous video. Now we're going to again discuss the lack of information. Let's frame it in a story again. This happened recently. I was working in an ER, and it was a rainy day. And when there are rainy days, there are often motor vehicle crashes, and many of them are small. People not really injured, maybe some neck and back pain, and you usually see them, treat them, discharge them, and send them home. On this particular day, I went to the gentleman's room. I recall him clearly. He was in room 3, and he had been involved in a motor vehicle crash. And his wife was there. He was laying on the bed. His wife was laying on the bed and was rubbing on his head, really babying him. Which is, when you see an older man being babied, it makes you for what you think is a small problem. It is another data point. I go and I see him, and as it turns out, he was in a small motor vehicle crash a few days ago. Still has some back pain, and he wasn't feeling well. And he'd already been to another ER. The ER had sent him home, and basically said that he had a back strain, and that he was going to be fine, some Motrin and some Tylenol, and so. What ended up happening then was I saw him, and he had some tenderness on his muscles, typical back strain. Vital signs were stable. His physical exam was completely normal. So, all right, this is in my mind, this is a back strain. I'm going to see him, give him Motrin, Tylenol, send him home. I explained to his family, to his wife, Motrin, Tylenol, They're physical therapists by training, so they're kind of agreeing with me. So I made my best decision based upon the information that I had. As I'm walking out of the room, his wife says to him, "Hey, I guess you can't run again." I'm a runner. And she goes, "Yeah, I can't run." I said, "Well, how often do you run?" He says, "I run every day." He was very adamant about it. I run every day. I said, "So when was the last time you ran?" He said, "About 4 days ago." Well, for a runner, you miss 4 days. That's a lot. So I just decided to do a CAT scan. CAT scan came back abnormal. They recommended MRI. Did an MRI, cutting right to the chase. As it turns out, he had a metastatic fracture, which means a fracture that was the result of cancer on that bone. By the time I left from that shift, he had already had CT, an MRI, a biopsy, seen by a neurosurgeon and an oncologist, and was about to start chemo. He was being admitted for chemotherapy. I had originally made the wrong call as a result of a lack of information. I was wrong. But fortunately, due to a few other questions, we got the right call. What's the point? There will be many times when there's a lack of information, and you still have to make the split-second decision. Because just because there's a lack of information, it does not mean that you are powerless. And if you have a lack of information and you make the wrong decision, be prepared to make the next decision. And for those of you all who purchased the book, and if you're watching this, you probably did, it talks about be prepared to make the next decision. To follow me, please follow me on my website, splitsecond.decisions.com. And most importantly, make your decisions and be prepared to make the next one and be kind to someone. Thank you very much.